各位朋友，大家午安，我是 Jeff， 在我右边的是 P-Force 的 CEO 跟 Chairman Dr. Sato。今天呢，我们来跟各位探讨的是关于棒球投手的这个问题哦。那过去很多人都问过说，到底是投球姿势呢，还是投球数，还是什么的问题，让这么多的青少年选手哦，在还没有到发光发热的时候呢，就因为这个受伤的关系就离开棒球场。那我相信很多的家长跟教练也很想知道，到底要怎么避免这些过早让选手呢发生伤害这个情况。那今天我们就请 Dr. Sato 呢用他的专业知识来跟大家分享。那大家也知道呢 ，Dr. Sato 在过去在大学时代，在美国的 NCAA 的一级的校队，其实担任棒球选手，他对棒球是有非常高的理解的。那我们来欢迎 Dr. Sato。Okay,
thank you. Hi, this is Dr. Sato in a P-Force office, and today we have a new shirt to present. So very colorful, like it very much. It'll be on sale from us very soon. Today's topic is actually not only the problem from Taiwan, but also I hear this a lot in Japan, and then of course I hear this a lot in the US. And then a lot of people talk about the issues on throwing mechanics along with the physical capability for, let's say, baseball players.
好，跟大家说明一下呢，大家我认为今天要谈的议题，事实上并不是只有在台湾而已哦。过去在日本，现在在美国，都有非常多的家长教练跟他请教这个问题。所以现在我谈的是一个已经是一个universal，是一个到处都发生的情况，并不是只有台湾，所以是一个非常关键的一个问题。
And the latest statistics, okay, this is from the data in the US, but back in the 1990s, so we're talking about maybe about 25 to 30 years ago, it was 0% of people under 18 years old getting any kind of elbow surgery. Now we're getting to, this is even from 10 years ago data, 30% of the surgery done for age 18 or younger. This is crazy statistics that a lot of kids nowadays getting Tommy John surgery in the US.
这是一个非常夸张的统计数据哦。在1994年前，这是美国的数据，在得到这个所谓 Tommy John 这个手肘的这个开刀的选手里面呢，没有任何一位0% 是在18岁以下。1994年的时候，在2010年，这已经是10年前了哦。就有30% 的18岁以下的这个选手，在 Tommy John 这个开刀的这些选手里面，有30% 是18岁以下，这个比例是非常夸张的急速在增加当中。
And then this issue is not only for, let's say, the baseball pitchers in the junior level getting more injury or anything. The injury was actually happened before, but nowadays the success rate of Tommy John surgery is very high. Okay, anywhere from 85 to 86% of success rate to come back to the state before they get injured or even better. So because the surgery technology got so much better, a lot of people consider having those surgery.
那有一个有趣的现象是呢，事实上经过统计85%以上的选手在开了 Tommy John 这个手术之后呢，会回到原本的状态，甚至可能更好，所以变成是。大家现在好像对开 Tommy John 这个开刀也没有那么在意了。
So the surgery used to be a risk for athletes, but now the surgery is one way to get even better. So that's part of the reason why this percentage went up even for the junior athletes.
所以呢，甚至呢，这个开完刀之后，有些选手他的表现比原本更好。这个在美国大联盟做过这样类似的统计哦。这也是因为为什么这个 Tommy John 在18岁以下的选手开刀的这个几率变高了，就是因为有些人甚至认为我搞不好开这个刀之后，只要我有一点问题，我开这个刀，搞不好我可以表现得更好。
So back in this August, okay, so we're talking about 5 months ago, I did a tutorial of Facebook. You can still go back to watch. I talked about the injury mechanics for baseball pitching, and we had over 15,000 views. Okay, off of a Facebook post. And then this is just a staggering number for me that a lot of people interested in this kind of topic.
那在去年的8月份，2020年8月份的时候 ，Dr. Sato 在P-Force 脸书上呢有做了一个影片，用所谓身体 力学的角度呢来分析到底什么样的动作、什么样的原因会造成棒球选手的这个受伤的状况。那这个影片呢，现在还找得到，在 P4S 的脸书还找得到，有超过15000个人看过这个影片，所以让大家意识到说，原来有这么多人关注这个议题。
So let's kind of cover what I talked about here in the next few slides, talking about how mechanics actually makes that much stressful for shoulder and an elbow.
那接下来这几章呢，接下来这几个投影片就来说明到底是哪些动作的问题会造成肩膀跟手肘的这个受伤的状态。
So the first one is talking about body tilting. Okay, so the body tilting, what I'm referring to is if you actually look at it from the front, okay, the body tilting is actually going this way. Okay, what's going to happen is if you tilt your body, it actually creates the arm to go up even more, puts a lot of stress on the shoulder. Okay, so this is actually a major mechanics fault. Okay, it's a mistake to have too much tilting body going this way.
好，第一个问题是，当你在投球的时候，你上半身轴心的偏移呢，让你的手肘自然的就往上举得更高，而这个状况会让你的这个肩膀的压力会瞬间变得非常多。大家可以甚至可以自己做看看，当你把你的同样的动作在上半身偏移的时候，在你在丢球那一刹那，你这个手肘的这边这个肩膀位置的压力是非常大的。
So I'll use Jeff as an example. So what I want to show you is when you actually get to here, okay, if your body position is, trunk position is straight, it's okay. But if the body starts to tilt, okay, the hands, the arm position goes up even higher, okay, and then that puts a lot of stress on the shoulder.
所以大家从这动作看的，如果是我的轴心是正的，没有问题；如果轴心偏移，我的手肘自然往上举。这个动作马上让我的这个肩膀产生相对大的压力，这个动作会让你的肩膀产生更多的伤害的可能性。
The second scenario is talking about lack of pelvic rotation. What that means is you don't have a whole lot of pelvic rotation, okay? So when you're actually throwing, okay, you don't actually have a lot of good mechanics to rotate the body. And then all of a sudden, when you start to throw, when you try to release the ball, everything rotates through and then the arm gets behind. Okay? And then that puts also a lot of stress on the shoulder.
好，第二个呢，在讲的是，当你的骨盆的旋转能力缺乏的时候，当你的这个轴心中轴的旋转能力缺乏的时候呢，等于在转的时候，你是瞬间整个都转出来，变成是这个动作会造成你的肩膀跟手肘的压力非常大。所以，如果你的这个骨盆跟你的中轴的旋转能力都非常好，等于像转毛巾一样，它是一节一节转出来的。这个情况下，才会让你的这个手肘呢产生一个比较好的外旋的这个结果，才会造成让它压力会比较轻。
And then I think a lot of the baseball coaches ask me questions about the rotation power. This is kind of a popular topic that the coaches ask me to talk about the rotation power. The rotation power, we're not referring just to rotate through the body, but we're also using a ground. Okay? We're using a ground reaction force to be able to rotate to transfer energy to the hand. Okay? But the problem is, if you don't have any rotation, then you try to rotate the body so quickly, and then you don't even have external rotation of the shoulder. And then this also limits that range of motion of the throwing arm before the release, puts a lot of stress.
好，那大少刚才也先强调一点，当我们很多教练说，你能不能教我怎么做旋转的力量的这个加强哦？但事实上，所有力量来自下半身跟地板的反作用力的产生，才能够产生这个旋转向上或旋转的力量。所以这个反作用力的这个部分还是很重要。再来就是，当你的这个骨盆、你的中轴缺乏旋转能力的时候，刚刚他提到，你的这个肩膀就没办法，手肘就没办法产生一个很好的外旋的结果，这个是会造成你的肩膀手肘非常大的一个压力的来源。
So it's kind of important to have that rotation in mind, and then be able to go from the pelvic to trunk, and then the shoulders show up, and then you have enough external rotation to generate the speed before releasing the ball.
好，所以大家看到刚刚的动作吗？从下半身反作用力上传之后，从你的骨盆到中轴 到你的肩膀，到你的手肘，它是一个像一个动力链，像一个那个毛巾在旋转的顺序一样的。当你有这个顺序的时候，你的这个手肘的这个 internal rotation 非常好的，自然就会产生一个比较好的一个加速的空间。否则，当你这个旋转都没有的时候，你这个手肘自然就必须靠手肘自然出力来产生球速，不然因为你没有加速空间，没有 external rotation， 所以你没办法加速的时候，就变成靠你的手肘在用力了。
Okay, let's go to the other one. Okay, other one is actually very similar, but this time we're talking about opening the front leg position and an angle. Okay, what that means is when you actually step forward from the windup, this leg opens up too much. Okay, and then if you can see from the screen, if I get my leg opened up too much, my body's already open. Okay, so there's no rotation. The body's already facing the hitter.And then you have to force yourself to bring your arm from the back here. And then, of course, that's going to put a lot of stress on the shoulder.
好，再来讲就是你的前脚的这个落地的位置。当你的前脚如果落地的时候开得太开的时候，你的气上你的这个 trunk 的这一边已经打开来，打开的结果你就没有办法有很好的这个旋转的状态。而这个时候呢，你的手肘又落后非常多，所以你只好用力的用手肘赶上来之后，这个时候就产生你的手肘跟肩膀非常大的一个压力。
So we talked about the 3 different topics. The tilting, okay, no rotation, or opening the leg too much. Those are the top 3 mechanisms that cause a lot of stress on the shoulder and the elbow.
所以我们再重复一下刚讲3件事情。第一个是你投球时候的中轴的偏移，第二个是你的旋转的能力，第三个是你的前脚踩出去踩太开了。变成你的整个身体整个开出来，没办法做旋转，这3个主要原因会造成你的肩膀跟手肘的压力。
So of course, the pitching mechanics is not the only factor talking about how the injury happens. Okay? There are many different factors, but the one thing that a lot of people talk about is now about the pitch count.
好，当然，身体的投球动作不会是造成伤害的唯一的可能。不会是唯一的来源，所以一定有其他的来源。那第二个我们要讨论就是所谓投球数的问题。
And then this is happening for several years in the U.S. that we have a pitch count limitation from the elementary school, junior high school, and then the high school level. So age-specific pitch count per day. And then if you exceed that pitch count, you have to rest for 4 days. So that's actually the regulation set by the organization.
在几年前开始，美国的这个棒球联盟不同年龄层棒球联盟开始针对不同年龄段的选手的投手设了投球数的限制。就是说你在单场的投球，如果投的超过它的限制的时候，你必须要休息，而且呢必须休息4天才能够投下一场比赛。
And then I know in Japan, specific to high school, now there's a lot of discussion about should we also implement pitch count for Japanese, because a lot of the Taiwanese baseball fans know about Japanese high school baseball, very popular. And then in the past, people like Matsuzaka are throwing over 200 pitches in one day, and then next day he comes back and then throw 180 pitches. Okay? That was just a crazy amount of pitch count for those teenage athletes.
那日本现在也开始有一股风潮在讨论说，到底这样的投球数的限制是不是应该在日本也必须要来导入？因为我们知道，像日本的选手田中将大，过去在青少年时期有一场比赛可以投200颗，隔天还可以投100多、180几颗。那像这个情况，因为美国开始做这个限制之后，日本也在思考说，是不是考虑应该要把这个限制也在日本的联盟里面做这样的规范。
So we talk about pitching mechanics can be a one factor for injury, and then of course, it does not actually matter what kind of pitch you throw. A lot of people used to think that the curveball, throwing too many curveballs is going to put the stress. Research is showing that it does not matter what kind of pitch, as long as you have a high pitch count, that leads to overuse injury.
好，有一个非常重要的观念跟大家分享。过去我们很多人说，就是太早投变化球，所以你就受伤。根据所有的科学研究显示，投什么球都没关系，只要你的 pitch count 呢超过一定的数量，你 就可能受伤。相反的，如果你的 pitch count 你的投球数限制有控制的话，你投什么球、变化球都没有问题。重点是投球数，而不是投什么球。
So talking about pitching mechanics, okay, talking about pitch count, okay, a lot of the coaches and of course the parents ask me how to prevent this, okay, and then this is where our expertise comes for training for those teenage athletes.
那我们谈到投球技术、投球动作，再来第二个谈到投球数的问题。那很多教练或选手会问说，或者是家长说，那怎么办啊？怎么避免这些情况？那我们接下来跟大家说明。
And many people who are watching know by now that before we work with any athletes, the first thing we always do is do any type of body assessment and then physical evaluation because we need to know the baseline of each athlete.
那我相信很多的观场有在注意 P-Force 的这些朋友们都知道，我们在跟任何一个选手、客户合作的一开始呢，一定会先做所谓的身体检测，透过身体检测了解这个客户、这个选手的身体的状态。
So we can look at any type of anatomical limitations. Okay? If you have any limitation, that can be a factor to cause mechanical misalignment of the pitching. So we do a lot of body assessment to make sure that they have a good mobility and stability. But in many cases, as I have checked so many baseball pitchers in Taiwan, not many people reach the standard.
好，一开始我们从解剖学的眼光来看这些动作就是说，我们通过这些动作的这个检测来看看你的身体目前的状态如何。那刚刚Sato也提到，以他过去在台湾做了这么多的棒球选手的身体检测的统计，看起来绝大部分台湾的棒球选手没办法达到他心中的那个标准，这也代表着大部分台湾的棒球选手的目前的这个身体的状态是需要调整的。
And some of the viewers also know that we use technology like pushband for jump testing or any other testing with a pushband, and then we have a ballistic ball to measure velocity of the medicine ball throw. The reason why we use those is to test those athletes to have a baseline data to know their physical limitation factors.
那当然，我们用像 pushband 啊，量这个爆发力啊，我们也用药球量测它的一些不同的动作的这个不同的投掷状态下的动作的这个产生的结果。透过这两次来看，这些选手在生物的他的这个身体的目前的状态下所呈现的数值为何。
So if we know that anatomical limitation from body assessment, if we know some limitation from the physical aspect, we know how to design the training program specific to those athletes.
所以，如果我们从解剖学的角度看到你身体目前的限制，我们又从这个透过科技产品的量测来看到你目前的不同动作下面你所产生的数值，就可以做一个非常精准的一个训练的规划。
So now you know this by now on anatomical limitation and then the physical limitation. Okay, a lot of coaches ask me, "What's the best exercise for baseball players?" Now you see here. This determines what kind of exercise best for that particular athlete. Not as a baseball as a whole, but this really sets us to know what kind of exercise selection and then the training volume necessary for those pitchers.
很多的教练跟家长问达斯Sato说，什么是棒球选手最好的体能训练方法？那Sato呢再次的强调呢，在回答这个问题之前，第一个，这个没有给全部人适用，一定是根据某一个特定人适用的。而这个特定人适用的这个前提是你了解他的解剖，从解剖学上面了解他的身体的这个限制条件，从这个量测上面看他目前的各种不同的数据的呈现的结果。你必须做这两个不同的测试之后，才能够针对这个个人做出最好的一个训练规划。
So let's talk about this from what I use a point system, just to make it easier for people to understand. Okay, I broke up the pitch mechanics and then the pitch count. Let's say each one weighs 5 points. Okay, and then your pitcher's physical capability, let's say 8 points. Okay, that means 10 versus 8. Okay, at that point, that risk of injury is higher because you have more points for pitch mechanics and then pitch count.
好，这个部分稍微做一个说明并不是真正要去算分数做量表，而是有个观念上的解释。也就是说呢，如果我们知道你的投球机制是造成你伤害的一个原因之一，主要原因之一，我们也知道你的投球数也是造成你伤害的主要原因之一。如果你的投球机制的错误造成的这个伤害的这个可能性是5分，而你的这个投球数造成的投的太多了，所以你的这个风险是5分。可是你的身体的能力呢，只能承担8分的这个能力的时候呢，那5加5等于10，10当然大于8，就代表你的投球动作错误造成的结果，加上你的投球数过多造成的结果，是超过你的身体可负荷的程度。这个时候你的发生伤害的几率就会非常高。
And here's another example. Okay, this is typically what I see in Taiwan or Japan. Let's say you still train, okay? The kids still train, so it's not 8 points. Let's say it's 10 points, okay? Pitching mechanics, okay, not great, but okay, so 5 points. But there's so many pitchers throw so many pitches, okay? 12 points, so 17 versus 10. Of course, they put themselves in a high risk of getting injured.
好，这个呢很有趣的案例，就是说你有做体能训练你有好好的做体能训练，所以你的身体的能够承受的这个风险从原本的8变成10咯。那你的这个动作还可以，所以风险5分没有太糟。但是呢，你投了非常非常多的球，所以你的风险非常高，所以你投了很多的球，结果5加2 17还是大于你努力做重量训练、体能训练的这个身体的状态，所以还是造成受伤的结果。
Okay, and then next one, okay, not very good pitching mechanics, and then the kids also don't throw that much, so 3 points, okay, and then not very good physical, but here 6 versus 5, so the risk of injury is still there, but not as high as previous slide.
好，这一章的意思就是你其实没有做什么体能训练，所以你的这个身体的这个目前能承担的是5分。可是呢，你的动作呢还可以，但你的这个投球的数字也没有那么多，看起来就是一个很平凡的一个选手。可是呢，相加起来3分加3分还是大于5分。也就是说，如果这个时候你做了一点体能训练，你可能就不会有受伤的情况。那也就这个图在证明，就是你不要以为你的动作风险很低，你投球数也很低，那 OK 我不用做体能训练，其实不是的。这个时候你只要做体能训练，做适当的体能训练，其实你的风险几乎等于0，就应该大于你的风险系数就会很低了。
So the idea of this, okay, no matter what kind of points you have, the physical capability has to outperform the pitch mechanics and the pitcher count, and then that's way to prevent those injuries.
所以真正该做的是什么呢？就是你能够控制的是，因为你要投多少球是教练控制的，你的这个动作要改也不是马上能改，但是问题是你能够控制，是你能够花时间要好好去做体能训练，把你的身体能够承担风险能力提高。如果你身体能够承担风险能力达到15分的时候，你就算动作还没有那么好，就算你的这个投球数有多了一点，但是你的身体能够承担的风险变高的时候，你就不会受伤了。
And then this happens a lot, but I know some of you probably have experienced this before. Sometimes, okay, they have not very good mechanics, okay, and then let's say this point is like 8 points, not very good mechanics, okay, and then they pitch a lot, okay, but no injury. Maybe because the physical capability point is high, okay, or vice versa, very good mechanics, okay, and then they don't pitch a lot. So this points, maybe 2 points, but if the physical capability is only 3 points, it's still high risk of injury.
所以呢，再重复讲一次，就是说呢，你有可能动作很糟，你的这个投球数率很高，但你的身体的训练做得非常好，所以呢，你还是不会受伤。但相反，你看投球动作很流畅，没有什么问题，风险很低，可是你的投球数也不高，看起来是最安全状况。可是因为你根本没有做身体的训练， 结果你还是受伤了。
Okay. Another good analogy that I would use is because I constantly communicate with major league, minor league coaching staff and to get more insight about the injury mechanism. And then one of the coach who is a batting practice pitcher told me the very interesting story about this theory. Okay? He's saying that he throws almost around 250 to 300 pitches 5 to 6 days a week because he's a batting practice pitcher. He said he never injured. Okay? So that tells me that his physical capability outperformed his pitch count. His pitch count is probably about 30 points. Okay? His pitching mechanics, he's not putting a lot, so it's not high points. But his physical capability allows him to pitch that many. So just only thinking about the pitch count as an injury risk is a crazy idea. If you have a bigger physical capability, I believe you can prevent those injuries.
好了，因为当时Sato是好几个美国大联盟的球队的顾问，那他也很常跟美国大联盟的或者小联盟的投球的教练或打击教练通话聊天。那前阵子他就跟一个在大联盟的这个教练呢聊了一个很有趣的事情。他说奇怪，觉得那个大家知道为什么这么多人现在受伤哦，投球受伤？他说我在春训的时候，一天投250颗到300颗，一个礼拜投6天、投7天，我都没有任何问题。那到底是什么？他认为这个教练认为是因为他的身体素质非常非常好。那当然他没有投很溜，但是投球就是负责喂球，当然不会投得很大力哦。所以他的这个投球的那个产生的压力可能没有很大，但是他的投球的量一定非常大，这个可能是30分的这个压力。可是呢，因为他的身体非常好，保持得非常好，所以他没有发生任何肩膀或手肘受伤的情况。所以这个对话让大家意识到说，其实我们单纯的归因说，因为你投球投很多，你动作不好，就一定会受伤吗？其实不是，关键在你的身体素质到底好不好。
So a lot of parents, coaches always come to peak force talking about what can we do, what kind of stuff we need to learn. Okay, we need to learn how to take care of this, and then we can kind of take care of this one. Okay, working with the coaches. Okay, we can take care of this one with the coaches, but this is the main factor for preventing those injuries.
当然，很多教练跟家长会问我们说，那到底我们该做什么？那还是回到最原始，我们可以控制，就是把身体给照顾好这件事情。当然，我们可以跟技术教练合作啊，透过生物力学或结果学角度来分析投球动作，来协助这个投球动作的修正。我们也可以跟教练沟通说，这投球数可不可以稍微控制。但真正最好的控制来自于我们对我们自己身体素质的培育跟这个养成。
So we're putting a lot of exercise together, and then we want to help those coaches and parents for their kids. So we have put some exercise together to provide through our, of course, the Facebook page, but also to reach out to different parents, different coaches for baseball community.
当然，我们非常希望能够透过我们知识的分享啊，跟教育啊，能够帮更多的家长或教练或选手，能够在青少养成的过程，能够尽量避免这个伤害的发生。所以，我们有包括很多的免费的影片的分享。当然，我们会做很多的课程，能够协助这些教练跟家长跟选手们。
So, especially for the junior athletes, I'm not talking about doing Olympic lifting. I'm not talking about the powerlifting heavyweight exercise. I'm talking specific to what we talked about in pitching mechanics. How to stabilize the trunk, how to do the pelvic rotation, how to transfer the energy. Okay, so those are the primary exercises to be able to do for the junior athletes.
那在这里都还没有谈到什么奥林匹克举重或者是所谓的力量型训练的这些动作，单纯只讲的是刚刚讲的3个，从解剖的角度来看，这些包括从旋转的方法来看，包括从落地的这个角度来看，透过这些类似的动作的训练，来协助这些选手建立这样的一个机制。
Okay, so as always, we welcome any questions that you have, and we're happy to answer for, let's say, the baseball specific, but any other sports-related injuries, because this is a hot topic. Sports injury prevention is a hot topic in a lot of different countries. So I want to make sure that I can deliver the right information with evidence-based research.
当然，我们也欢迎各位朋友呢提出问题来讨论。当然不是只有棒球了，那运动伤害防护、运动伤害预防这个问题，当然在这几年变成一个显学。因为大家知道，运动选手在训练跟比赛过程中不断挑战自我的极限嘛，所以这个伤害发生的几率是非常非常高的。如果有任何的资讯跟方法，我可以协助教练、选手跟家长们，我们都非常乐意来分享。
Okay, thank you very much.
好，谢谢大家。